When I first start seeing patients when they're newly diagnosed, it's a very interesting interaction. It's a very important initial interaction because patients are very confused. They're confronted with an onslaught of fears, uncertainties, new language, new people, and it's very important to establish a rapport, but also to be a good listener. But at the same time, we want to direct them towards understanding as best they can what's happening to them. So the first part of the time that I see them is just to get to know them, to get to know about their family, get to know about their signs and their symptoms. And then I try and introduce the subject of the disease as best that I can. And so we do that with the patients looking at their own MRI scans. We show them what it looked like before surgery, after surgery, explain what MRI scans are and how we're going to use them in the future. And then in addition, I'll give them the report of their pathology so that they read the report that the pathologist gives us so they know what the name means, and they'll have that as a reference, so they'll keep their MRI scans and their pathology report with them. And then we'll talk about what the disease is and what it means to them and what the potential treatment options are. And I want to emphasize potential treatment options because patients have to make a choice about what they want to do, and it's very difficult to make choices unless they understand what they're facing. So they have to become a participant in the risk and the benefits of various kinds of treatments because some treatments will have very little risk, others will have more risks. Some treatments will be much more complicated, particularly in clinical trials, which we can talk about, where there may be more inconveniences. They'll have to travel more, they'll have to do more tests, and there's more of a level of uncertainty about what's going to happen in that environment. And then we'll talk about the follow-up, how we're going to follow, what's going to happen if their disease stabilizes, if it doesn't stabilize, and what the options are. So in that very first meeting, we want patients to be comfortable enough to ask questions, but also to get answers and to understand the process and what's going to happen along the way and how we're going to use all of the tools that we have to help them. And invariably, they also want to know, although it may not be at the first meeting, it may be at the second or the third meeting, what their survival expectations are going to be like, what they're going to feel like. And that's the time when we start to talk about symptoms and signs and what will happen and what could happen and what to expect, and then how to interact with us if things happen that they don't understand.